Greetings all, welcome back to the Forum podcast where we work to bring you interesting and useful content relevant to cancer charities from around the world. American Cancer Society has over the years created some truly useful tools and materials that we love to share. Delighted to share with you today some incredibly impressive work that we have. It's called the Cancer Atlas. It is an interactive tool that allows our users to explore content, including cancer incidents, causes of cancer, and the ways that we are working to tackle the problem. This is just really top level stuff. However, I'm really pleased to invite a colleague of mine, Dr. Ahmadine Jamal, to discuss this with us and share a lot more insights. Ahmadine, welcome to the call. Great to see you.
Thank you, Matt, for having me on your podcast.
Absolute pleasure. I love the Cancer Atlas. I was made aware of it soon after I started at the American Cancer Society. And from time to time, I do find myself drifting to it to explore and to see some of the insights that it provides. But before we dive into it, tell us a little bit about yourself and your background, if you would.
Okay, yeah, thank you, Matt. I'm originally from Ethiopia. I came to the US as a graduate student. And then after graduate school, I had a postdoctoral fellowship at NCI, specifically Division of Cancer Epidemiology and Genetics, and I did a cancer epidemiology fellowship for 3.5 years. And then I joined ACS as a cancer epidemiologist in 2001. I haven't left it because I love it.
What a great story. You love it. And I love working at ACS as well. It's a really great community to be part of, people pulling together to fight cancer. So tell us more about your role at the American Cancer Society. What do you do now?
Yeah, so I lead the Surveillance and Health Equity Science Department under the Discovery pillar. And the goal of the department is really to conduct innovative and collaborative research and disseminate information across the cancer continuum, from prevention to early detection, treatment, survivorship, in order to inform and also advocate for public policy, cancer control programs, guidelines, with the ultimate goal of really achieving health equity. That's an overarching goal of our department vision or goal, I should say.
Fantastic. So you're creating content that can be useful to colleagues to then further their work as we all fight cancer together.
That's correct. Yeah. So we specifically look at really we work with the scientists in other pillars, also within Discovery pillar, and we work closely with the ACSCAN, which is the advocacy arm of the American Cancer Society. So we work with them to identify and fill research gaps for evidence-based decision making. I can give you examples if you need.
We would love to hear some examples. That'd be great.
Yeah. So the examples, the first one I would like to talk about is that our work that on early onset colorectal cancer, which is led by fantastic scientist Rebecca Siegel, that has been a catalyst for the American Cancer Society to lower the age for initiation of colorectal cancer screening from 50 years to 45 years. And after 2 years, actually, the US Preventive Service Task Force also changes its recommendation to initiate colorectal cancer screening from 50 years to 45 years. Another example is a work from our group on insurance and survival informed the Affordable Care Act, widely used by for advocating the passage of the Affordable Care Act. And also since the passage of the Affordable Care Act, our work also works specifically on the benefit of the Affordable Care Act, specifically on Medicaid expansion, has been used to defend the Affordable Care Act in court, including at the highest level, the Supreme Court.
Wow, incredible. That's such useful work. And so the Cancer Atlas is something that I mentioned earlier and it grabs my attention. Tell us a bit about this, because I know it originated as a book and I know it's been published in a few different languages and it's now online. But could you tell us a little bit more about the Atlas itself and
Sure.
maybe some of the features?
Yeah. So another area, just before I talk about the Atlas, another area that is our group is known is facts and figures. Okay, this is ACS's flagship publications. So this is one way of disseminating information on cancer prevention and control in the States and worldwide. So in 2006, when the American Cancer Society developed interest in mitigating the increased burden of cancer worldwide, we were our group was tasked to develop cancer facts to extend our facts and figures to global cancer facts and figures, and then also the cancer atlas. So we published the cancer atlas in 2000, first edition in 2006, and also our first edition of global cancer facts and figures in 2007, I believe. And now we have the third edition we published the third edition of the cancer atlas in 2019. Actually, the second edition of the Cancer Atlas that was published, I believe, in 2014, was translated into 9 languages,
Oh,
including
wow.
Turkish, Farsi, Chinese, Arabic, French. Yeah, just 9 languages. The 2019, because of the COVID, it was not translated to many languages, but it was only translated to Arabic. So the Atlas is really, it is a tool for cancer control advocates, policymakers, educators, cancer control programmers to really apply what we know in cancer prevention and control locally, nationally, and globally.
Fantastic. And being global, actually, the people watching this podcast can access it themselves and take some of the content and understand it and use that for perhaps their own work as well.
Yes, actually, the beauty of the atlas is it's not only in print; it is also available on the web. It's, as you might said, it's an interactive website. It is really created in the with a mind of more accessible and also shareable. You can download figures, maps, and also you can share it in social media. So it is, you can compare your country with your neighboring countries and other countries throughout the world. So it is really easy to use uh, tool for uh, implementing cancer prevention and control, as I said, locally, nationally, and globally.
Just as you were talking, I took the liberty to just pop it onto the screen here with us, the online version, which for our partners watching, the web address is canceratlas.cancer.org, and you can locate this tool here. I'm not going to spend too much time looking through it just here on the recording, but it's there for people to explore if they like. I mean, this is such an awesome tool. It's great to hear that it gets translated into different languages. It's applicable and accessible for all of the cancer control entities out there. What do you see in the future? Do we have anything new or anything different that you see coming down the line, or are we just in a position to keep recreating it with updated facts?
Yeah, I think that, as you know, the information changes, the burden of cancer changes, and also the risk factor changes. We have new risk factors. Okay, for example, climate change. Okay, and the also the way we prevent, detect, and treat cancer changes. So we are updating the cancer atlas. Now we have started updating the fourth edition of the cancer atlas. We will be publishing it in 2025, hopefully, and we are expanding. For example, in the previous Cancer Atlas, we had 40 chapters, but this time we'll have about 45 or 46 chapters with new chapters like climate change and the cancer, social determinant of health. Now it is a big factor, which is really, which has never, an important topic, but hasn't
Hmm.
uh, never received the attention it deserved. So we are also separating alcohol, because alcohol is now major, because there is an increase in binge drinking or heavy alcohol consumption in many parts of the world, and we know that alcohol contributes about 4 to 5% of cancer cases and deaths in the world. So yeah, we are expanding and staying current with science.
Of course, that makes so much sense. Well, it's so good to hear that. And I understand at the moment you're just reviewing the Cancer Atlas and looking for some feedback. So, with the email that I'm sending out, I'll invite any of the viewers to provide some feedback to this Cancer Atlas to help us to shape the future of it as well.
Yeah, thank you, Matt, for doing that. This is something that we wanted to know. Why they are using it, for what purpose? Okay, what are the challenges? Is there any information that is missing? So we would like to have feedback on improving the Cancer Atlas.
Perfect. Amadin, thank you so much for taking the time to join us today to share a bit about the Cancer Atlas and about your broader work at the American Cancer Society, and for us to understand how we can draw on that work and further all of our fight against cancer. So appreciate it. Thank you.
Thank you, Matt, for having me.
Pleasure.
Bye now for now.